It's my pleasure to welcome and to introduce Tom Evans, who's Chief Scientific Officer at Vaccitech, the UK privately owned biotech company whose technology is behind one of the most advanced COVID-19 vaccine candidates right now, the program being run by AstraZeneca and Oxford University. So Tom brings, I think, a rather unique perspective to our session, our reflections on the pandemic session, because he's worked both across industry within biotech and big pharma, in academia and in non-profit organizations. And so he understands, I think, more than many of us, the different kinds of institutions which are now deeply involved in fighting this pandemic, and perhaps a little about their strengths and their weaknesses and what they bring to the table. So just for a bit more detail on Tom's background, he was infectious diseases division chief and a professor at the University of California. He's been global head of infectious diseases, translational medicine and research at Novartis, within Novartis's Institutes for Biomedical Research. And from 2010, he was chief scientific officer and then went on to be CEO at nonprofit ERAS, whose mission was to develop a global vaccine for tuberculosis. I believe ERAS was funded by the Bill and Melinda Gates Foundation, as well as the UK's Department for International Development. So with all that experience in mind, I'm really looking forward to asking Tom, how he feels these different kinds of institutions, these various bodies, from the non-profits to the for-profits, and transnational organizations like Sepi and Gavi and the WHO have responded so far to the pandemic. And given the subheading of the good and the bad and the lessons so far to our session, perhaps, Tom, we can start with the positives and what's gone right as far as the response to the pandemic so far, in your view.
Certainly the multinationals have stepped up in a way that's more positive than I might have expected, given their sort of desire to make a lot of money. They've really, I think, gone forward with let's say that they've taken steps forward without being reassured they're necessarily going to make any money, which is new for them. So they've jumped in sort of both feet first. I think they still hope to make a lot of money out of it, to be really honest, but they've done it without necessarily having that expectation. So that's a positive. We haven't seen them do that really in any way, shape, or form. It's one of the issues is infectious diseases has been sort of the stepchild of the whole industry. Being in the infectious disease space, you go to investors, you basically, they're not interested in vaccines. They're not interested in infectious diseases. They're not interested in antibiotics. Almost every major multinational shut down their antibiotic research units. So this is a good step forward. I think it's re-engaging people. When people lose $1 trillion, they get interested in a field again.
Right.
People, it's one thing to make $1 billion, but it's another thing to lose $1 trillion. So some people eventually people understand the need to do things proactively. Right.
And so the multinational for-profits, so the industry, the big pharma, you're saying it's been a surprisingly positive step. What about Sepi, for example? I mean, Sepi set up.
Sepi, the issue with this pandemic is that it hit about 3 years early for Sepi. So Sepi was set up post Ebola. Sepi is a great idea. You need to be able to drive the academic. So what would happen in vaccines is there was a lot of academic movement, but not many of those things actually got into the clinic and got through to what we would call near a proof of concept, or at least a phase 2, and certainly not making a stockpile. And Sepi was set up to take the most important diseases in the world, including disease X, which has now happened, and to make sure that there was basically the platforms were there, the infrastructures, the right kind of different platforms were being funded, and that they would have a stockpile ready to go when an outbreak had happened. The problem was the Sepi just got set up about 4 years before this happened. they were just getting their legs off the ground. They were getting, they just finished hiring all the people they needed to hire. I would say they were just becoming a fairly functional body at about the time this hit. So I think that their response could have been even better if this had happened 2 to 3 years later. But it's pretty impressive what they've done. They've managed to, fund a lot of the different leading platforms. I think they jump-started it while over the first month or two, while the multinationals were still trying to feel their way around. Where are we going to get in? How are we going to get in? What are we going to get in with? The good news is that many of these companies already had relationships so that they could jumpstart. So Pfizer and BioNTech's a good example. They had an ongoing relationship that allowed them to capitalize on that. Merck and Themis. Merck is one of the leading manufacturers of measles, so it's very easy to buy Themis because you already have the entire manufacturing platform ready to go. So there's been a lot of positives, I think, come out of it on the vaccine side.
So Sepi, so just to go on, set up, I think it was in response to Ebola, wasn't it? It was
correct. It was. I mean, the Ebola response was a complete disaster. Let's be honest with it. And the Liberia, the West Africa Ebola response was so incredibly disjointed. It took a long time. By the time vaccines got made and got tried, the epidemic was almost over. So, the GSK and J&J vaccines, which were the adenoviral vaccines, didn't get tested in the field. The only one that got tested was the Merck VSV. So the idea was, instead of taking a year or however long it took to get that ready, let's do something. Let's set up a system so the next time that happens, we're ready in 2 to 3 weeks.
Sepi was the lessons learned from last time then, really. I mean,
and I think what will happen this time is we'll get Sepi Plus, right? So we'll, you get Sepi coming out of an Ebola crisis, and we'll get through this crisis, and then people are going to look back and say, okay, look, it was great that we had Sepi there. It was great that we had certain international institutions. It was great that pharma stepped up. What is it that we need to do better?
Right.
Do we need to take Sepi and build on it? Do we need to restructure it? Do we need to reinforce it? Mm-hmm. But those learnings will come. They're not there yet. I mean, we're still working through this.
Right. And directionally, you seem to suggest Sepi was doing the right things. It just hadn't had long enough to set itself up fully.
Well, I think Sepi was moving in absolutely the right direction. I mean, it's hard setting up an organization that's trying to, work on 5 or 6 different diseases for, across 3 or 4 different platforms when, you have to hire people, you have to get your structures together, your organization, your contractual, your philosophy, right. About how much you're going to demand from the people that you're giving money to.
Sure.
And Sepi, I think when they first got set up, to be fair, was not I think there was some disagreement about how far they needed to be able to drive things in terms of the response. They were set up to do small stockpiles. They were not set up to manage trying to make billions of doses of vaccines, right? They were all of their original calls for like 100,000, 200,000 doses, sort of the ring vaccination strategy. So they've been pushed into an area that was not really in their original mandate.
Right. And I want to get on to the role that Big Pharma, I want to come back to Big Pharma, given the audience at the conference and biotech and what they've brought in terms of pan-national, international coordination. But first of all, let's just say a few words about WHO. I mean, the main strapline seems to be, look, they're there as a global health body, but they haven't got enough money. Is that oversimplifying it, or would you say there's a positive side? I mean, where do they sit in this response, in your view?
Yeah, WHO is not it's a policy organization. It's not an execution organization. They don't have the funds to execute. They're there to make recommendations to governments. And I think There have been a lot of criticisms of WHO. They're chronically underfunded. It's a tough organization, right? You're trying to organize all the countries around the world. The resources are different in every country. The responses are different. The politics are different. I think WHO itself would look back and say they haven't done a great job here. I don't think they were as prepared for this as they should have been, especially given the Ebola epidemic. I think they could have been better prepared to deal with this. On the other hand, when it first broke out in China, they were totally on top of things. They were leading the pack. They really people turned to them at the initial part of this epidemic back in the January, February timeframe. And their voice has been, I think, a little bit lost over the last few months. And I think that's because they haven't been allowed. The national governments haven't pushed to put them in the front of the leadership. Part of the problem is that you have the two largest economies in the world are not exactly playing, by WHO rules. That makes it tough, when the two biggest economies aren't necessarily backing the organization that needs to be backed to be the global leader.
And that's, we could have an entire other session about geopolitics now.
Let's not talk about that.
Let's not. Let's not. But one thing.
The good news that you brought up is that it's funny, you think of the politics, but the group that's actually transcended the politics here are the multinationals, which is bizarre, right? So you look at, for example, AstraZeneca that licensed the vaccine we were working on with Oxford. And they've managed to, get funding from EU, from the UK, from Brazil, from, they have things in India. They have the whole, 1.2 billion, not million, billion from BARDA. They've managed to get over 2.4 billion, I think now it's up to, now that they have the Brazil and the Indian. They've been almost like an international organization themselves. They're doing that. J&J's doing it. I think Pfizer's probably in the background doing it much more than we expect. So that's been a real interesting thing, which is that you have these businesses that don't necessarily that are working in a way that allows them to
transcend the borders.
To translate, and because they're for once and all, they're saying we're not entirely driven by profit. They are being accepted more readily by the places like India and Brazil. Getting into Brazil before, it would have been impossible.
But as you say, and I think that's a great point. I think those, big pharma, there's a lot of talk about, this is the chance to reset the reputation of the industry, to remind the public of the role of the industry and why it's there and what it does. And I think that transcending the national sort of patriotism and protectionism is a really important point. But as you alluded to, this hasn't played out yet on the profit side. I think they are, being transparent about doing this not for profit. We just had the price of remdesivir, Gilead's drug, today or yesterday, I think. So, yeah. I think at cost and the definition of at cost is a whole other debate that we could have, but I agree that it looks good so far in terms of that collective effort.
Yeah, and you got to be, you have to be careful about nonprofit, right? So,
right. What does that mean?
Because if you take the money that you made from this and build a $400 million manufacturing thing that becomes something else. Come on, that wasn't.
But that's fine. Yeah. As long as it's affordable and the medicines and the vaccine gets to where they need to go, I guess they get their investment or whatever. Anyway, I'm sure we'll have other sessions about that particular.
It'll play out, and in the end, there will be heroes and there will be non-heroes. Right?
Absolutely.
So,
absolutely.
People are seen as scamming and making as much money as they can from it, and there'll be people that are seen as stepping up and having done the right thing.
Yeah,
and hopefully people will be on the right side of that.
Absolutely. So I think, Tom, we've covered, both the good and the bad in that, haven't we, so far? Some of the cracks, the lack of coordination, the lack of funding for WHO, you know, there's a lot of good, there's some lessons that can be learned already. Just before, I want to go on to sort of science and what this pandemic has done for science as a practice, as a discipline, and the method of science. Before I do, I mean, is there any one lesson you think we've already got out of perhaps some of the cracks in the response so far? You know, when we were talking earlier, you mentioned the sort of the lack of regional, local, global health system coordination. Is there anything very briefly you want to say about that before we go on to the science side?
The cross-national WHO kind of the CDC-like networks in the WHO, that needs strengthening. The last thing that people need to do is start pulling out of that. We need to, if people have problems with the WHO, let's fix them. Not try to get rid of it or do it. So it is a critical body. It is the World Health Organization. They've done amazing things, and they wasn't there a century ago. We need to take all the learnings from this and strengthen that institution cross national.
Sure.
For sure. Science-wise, let's jump into the science. So the good news about the science is that as a vaccine person, we're going to get to see a lot of platforms compared, hopefully using the same assays in the same place. We're going to understand each of these platforms. It's not like, viral vectors are better than RNA or better than adjuvanted proteins or better than killed, viruses, blah, blah, blah. Each of these platforms will engender different immune responses. And many of them will probably work against coronavirus, and some of them might not. And we will learn that stuff. The most important thing is not to say, okay, that's a crap platform because it didn't work here. What you should say is, boy, that's interesting because in this setting, this is what that did, and then you can apply that to other settings. So you learn a lot.
That's interesting.
Yeah, on the bad side, the quality of science that's come out that's being published is just rubbish. I mean, bioRxiv is great in some ways. In other ways, it's the death of science. I mean, it's just been horrible to see some just really poor quality, non-peer-reviewed things get picked up by the press and been put forward as being science. When science is something where you pose a hypothesis, you have the appropriate positive and negative controls, and that can be repeated by another person using the same methodology. Boy, has it been
there's a balance strike between, there was an editorial in Nature Biotechnology, you want this openness, you want the sharing of the data as much as possible, including negative data. And these bioRxiv platforms, as you suggest, have just blossomed. But on the other hand, as you say, you don't want to undermine the scientific method. But do you think on balance it's been better that the peer-reviewed papers have been available and shared? Or are you saying actually, no, this could damage the scientific?
On balance, I personally believe it's going to be negative in the long run. That's just my personal opinion. I think that in the short run, it's been good because people have been open and sharing, and we need to open and share. On the other hand, science isn't about doing one experiment and then sort of saying that you have an answer. It's about doing the right experiments and having the right controls.
Yeah.
And I worry that the general public and the general understanding of what the right scientific method and what peer review is supposed to do is going to be partially lost in this, and that could have long-term damage. So in the short run, it's been fine. I'm just worried about the long run. I'm worried about the damage to sort of what people think the scientific method really is.
Okay. And as we draw to the end of these reflections, Tom, do you think the investor interest, given our audience here, do you think the investor interest in vaccines development, in infectious diseases, do you think that will be maintained? Or do you think it's going to increase, spike now, and then it'll drop off again? Or do you think this is for real now? This is going to really raise awareness for the long term in vaccination, in prevention, and in infectious diseases?
You know, having been around doing this for 35 years, I'd have to say it'll be a more prolonged spike than it's been in the past. But look, we had, AIDS come in, and then we had the 2009 H1N1 pandemic, and some facilities got built and some things happened. Then we had Ebola, and, even post Ebola, it was really impossible to get people really interested in vaccines. Most of the investors slammed the door in your face. They're slowly opening back up now that they realize that this is a important area, and also they think they're going to make money in it, right?
Right.
As soon as they see that, yeah, I guess I'm more skeptical that it'll have a long run effect. I think it'll have an effect over years as opposed to, say, months or maybe a year. Maybe it'll have effect over 2 to 3 or 4 years. Whether people are going to start to realize that, infectious diseases are really important. I think, I've mentioned this before, 1.6 million people die of tuberculosis every year. 1 billion people have died of tuberculosis. You don't see, anybody making an investment there, but it has huge impacts on economies, massive impacts. So where's industry? They're nowhere. They're absolutely nowhere. Right? So.
Maybe this epidemic, having struck where it has, will be different. But I hear and I understand your skepticism. Tom Evans, thank you very much for your reflections. Appreciate it.
You're welcome. Have a good conference. Thanks.
Thank you.